Thank you so much, Emily. So I will talk about bias and discrimination, misuse, and ethics versus law as a way to regulate AI. I will use a case study to do this, and the case study will be AI technology to identify genetic diseases by looking at someone's face. It's something that has received a lot of media attention. AI tools for assistance with medical diagnosis can be remarkably efficient. This paper shown here and its sister paper made a big splash in the genetics community because it represents a huge advance medically speaking. So children it would take years to diagnose can now be diagnosed rapidly. It is so efficient that it can actually reveal information that cannot be picked up by experienced health personnel, and it can even detect carrier status. So by a combination of exome data, clinical features, and portrait images, you get a 99% top 10 accuracy in this paper in a cohort comprising 679 individuals with 105 different monogenic disorders. So seeing as I'm a co-author on this paper, I will use it as an example of an incredibly useful medical AI tool that also raises difficult questions in terms of bias and misuse potential. The sister article explains the algorithm. So it works in this way that a new input image is pre-processed to achieve face detection, landmark detection, and alignment. After pre-processing, the input image is cropped into facial regions, and each region is fed into a deep convolutional neural network to obtain a softmax vector that indicates its correspondence to each syndrome in the model. Then the output vector of all regional DCNNs are aggregated and sorted to obtain the final ranked list of genetic syndromes. So the histogram you see on the right side represents the output syndromes sorted by the aggregated similarity score. Now let's have a quick look at transparency before we move on to these other issues, because this is a 10-layer deep convolutional neural network, and neural networks are, as you all know, notorious for being difficult to explain. However, we found that it is actually not as hard to fulfill the transparency requirements as many will have you believe. So we achieved this by a 3-layered explanation. One very easy explanation about how the model works, a more detailed explanation with photos and examples of transmitted data, as you see in this slide. And finally, for those particularly interested in the details, a link to the Nature Medicine paper explaining the algorithm, and prior to the publication of that article, to the preprint. Now, I want to ask you all a question, and that is, one of the first authors on the paper ran this model on himself, and it came back suggesting that he had an intellectual disability. Now, this guy is an incredibly bright clinician scientist. So how could this happen? I'm not sure if anyone has any suggestions for this, but I can tell you what did happen. What happened was that this was in an early phase, and this software that can get thrown off. And so when this guy uploaded a photo of himself, the tool may have been stumbled by the facial features that related to his ethnic background, which is a combination of European and African, because the algorithm was at that point mainly trained on people with European ancestry. Also, suggestions will also always be made. And so this brings us to the point that personal data should be processed fairly in relation to the data subject. And if there is a bias in the training data, this can give rise to a corresponding bias in the algorithm. Of course, bias can also come from the biases of the people who build the algorithm, which was not the case here, but maybe the case in other instances. We therefore included a sentence about this, or two actually, in the paper to make it very transparent that this might be an issue. So we said, well, we include and strive to include a wide variety of ethnicities, but European backgrounds are currently best represented, leading to best performance for this population. As the data set expands further, the algorithm will improve for currently underrepresented ethnicities. And this is a difficulty that may be faced, for instance, in the medical field, and here in particular related to genetics, because this is a tool to be used in combination with exome sequencing. Now, exome sequencing machines are incredibly expensive and require stable electricity output. So there are some of these machines also in Africa, but there are not that many. And so it takes longer to obtain the same amount of data that is required for rare genetic disorders in Africa than it does in, for instance, Europe. As this was a tool that was so powerful, it was necessary to also come with a warning publicly. And this was then done to say that actually the same type of algorithm can be used, for instance, so that people can scan Facebook photos to discriminate against employees with genetic diseases. And in general, AI tools can be applied outside its intended context for other purposes. Can be applied for law enforcement and misused for discriminatory purposes by employers as here, or insurance agencies, or others. Also, although this relates to social media, that's not the only place your image is often available. This is my own profile page at the University of Oslo, and my employer posts photos of all the researchers at the university, open for anyone. So how ought we regulate AI? A British report showed that the British media coverage of AI is industry-led and thus agenda-driven. The report shows that less legal regulation is often encouraged, combined with threats that other parts of the world will get the upper hand and one's own country will miss out. So this creates this constant need for urgency in this field. And I therefore also wanted to just tell you that we at the Norwegian Research Center for Computers and Law have been working on AI and law since 1970, where the now late Professor Jon Bing started a project on AI and law. I also took a walk into our library, and I'm here showing you some publications from the 1980s and 90s related to AI. And there's a poster that was hanging outside my office from the 1990s, also related to AI and law. So we've basically been doing research on this for the past 50 years, and we're still doing it, keeping up with the technological development. There was a piece in The Guardian some time ago, and it said, well, AI's progress is unstoppable, so don't worry your silly little heads fretting about it, because we take ethics very seriously. This was then seen from an industry perspective. And they said, well, another plank in the industry's strategy is to pretend that all the important issues about AI are about ethics, and accordingly, the companies have banded together to finance numerous initiatives to study ethical issues in the hope of earning brownie points from gullible politicians and potential regulators. And we've seen several media stories like this, also showing the ethics centers of several of the large tech companies and how they finance research centers also in Europe. There is a concern, therefore, that ethics washing is going on. So by pointing to ethics boards and charters, companies can state that they are doing something, thereby avoiding criticism. But because the ethics boards often lack veto power, the companies are not forced to follow their advice. Do we have legal regulation in this field? Yes, of course we do. So we have the GDPR, and a member of the European Parliament sent a letter to the EDPB asking if this is considered sufficient. And the EDPB answered yes, specific legislation related to AI would be premature at this time, but we may come with some guidelines. Well, the EU itself has also published a couple of reports, as I'm sure you all know these, with both ethical principles and more legal principles. At the research stage, a lot can happen. IBM's Watson for Oncology received a lot of media attention when internal documents were leaked, showing that Watson had suggested unsafe or wrong medications that may have killed the patient. So what media was not always very good at expressing was that these so-called patients were simulated. So basically they were just dolls. So no harm has happened when you're almost killing a doll while testing a solution internally. But if you implement the solution into healthcare, the situation is clearly very different. So we rely on evidence-based medicine, and there cannot be exceptions for AI in terms of evidence. Eric Topol published a brilliant and very thorough AI review article in Nature Medicine stating that, quote, "The field is certainly high on promise and relatively low on data and proof. There cannot be exceptionalisms for AI in medicine. It requires rigorous studies, publication of the results in peer-reviewed journals, and clinical validation in a real-world environment before rollout and implementation in patient care." So how do we solve the regulatory challenge? Well, one possibility may be to primarily rely on existing data protection and non-discrimination legislation and just add a few elements of sector-specific legislation where needed. The United Nations Special Rapporteur on the Right to Privacy, Joseph Kanatachi, has issued a recommendation on the protection and use of health-related data globally. And many of the people contributing in today's conference are part of the Special Rapporteur's Health Data Task Force and played a role in the drafting of the recommendation. Amongst these, our chair here today, Nikolaus, who also chairs said task force. So the Special Rapporteur's recommendation is an instrument in harmony with all main data protection instruments, and it also includes specific provisions on health-related AI, which may serve as a model for those seeking to develop legislation in this sector-specific area. The rules do, for instance, relate to evidence and bias. In terms of evidence, it says that health standards will not be lowered to facilitate deployment of data processing technology. Forms of processing that have not yet transparently proved their efficacy shall be subject to the scientific research provisions. And in terms of bias, it says that bias must be identified, it must be disclosed, and it must be taken into consideration when using the tool. Thank you.
Great, thank you so much, Heidi. That was a really fascinating presentation.